Some of the times you guys might be wondering about why your doctor have said to have a ECG or electrocardiography. So today we're gonna discuss all those things, why they are saying for the electrocardiography, why it is essential for us, and what are the aspects and myths about ECG. So hello guys, this is Amit over here and you are watching Techomath. So without any further delay, let's get started. So let's have a look towards the definition of ECG, what exactly it is. So the ECG is electrocardiography, and it is the process of analyzing the electrical activity of a heart. And electrocardiograph is an important tool for that recording purpose. Now two of your questions get clear, that what is electrocardiography and what is electrocardiograph. And ECG is the short form of electrocardiography, and EKG is also the short form of electrocardiography. Most of the time it happens like we used to write like electrocardiogram, but exactly we have to write electrocardiography. So the electrocardiography is the process, electrocardiograph is the machine. So let's have a look towards what exactly happens in that process and why doctor suggests us to have an ECG. By having an ECG, we will be able to analyze the particular rhythmic rate and electrical activity of our heart, so that we will be able to understand our heart is properly working or not. Or if we are suffering from some disease, or if you are in contact of or in the cause of some disease, we will be able to know as early as we are doing an ECG. And from that ECG also we will be able to understand about the proper breathing rate also, and due to which we will be able to understand and analyze the cause of having a smaller heartbeats or a larger heartbeats or a uneven heartbeat. I can say like symptoms of having irregular heartbeats we will be able to analyze through having an ECG, that is electrocardiography. Basically in this process we will be having a machine called electrocardiograph. In that machine there is to be a traditional, if you're considering traditional machine, it will have 12 leads, and in 12 leads we will be having 10 electrodes. In which 10 electrodes there used to be 6 electrodes for chest leads will be placed on your chest, and 4 leads are be like left arm lead, right arm lead, left leg lead and right leg lead. So the total consistency is of 10 electrodes and 12 leads. So now the question arises in our mind, how the electrical activity arises in a heart. The basic function of heart is to pumping of blood, and for that pumping there used to be the closing and opening of valves and contraction and relaxation of the muscle, and that contraction and relaxation is also known as repolarization and polarization. Also can be said as the diastolic and systolic process. Now you guys might have understood what exactly ECG is, EKG is, or I can say electrocardiography or electrocardiogram is. And basically the output comes in the form of a waveform consisting of the peaks P, Q, R, S and T. That graph of waveform is known as electrocardiogram. Now let's have a look towards the myths and facts about ECG, which some of the people don't know, and myths that people used to carry in their mind. The very first myth about ECG is that there is to be the risk of electric shock, but the fact is no such kind of thing happens. There is no use of electricity which is going to pass in your body. It is completely safe procedure. Second myth about ECG is that if you are having a normal rhythmic rate or a normal ECG, your heart functioning is very good. But the fact is that there is no possibility of having an heart issue and a normal ECG. It can be the possibility of having a heart issue with a normal ECG also. The myth about ECG is that also that ECG can detect heart attacks and heart failure, but ECG is not that much capable to analyze the heart attack and heart failure, because sometimes in the initial stage of heart attacks it starts giving the normal reading. The myth about ECG is that if you are having a normal ECG, you will be having a normal blood pressure, but the fact is heart rate and blood pressure are not necessarily correlated. Sometimes it happens you might be having a high blood pressure with a normal ECG or low blood pressure with a normal ECG. The best way to resolve these things to have a blood pressure check regularly. So guys, I hope you might understand about the difference of the similar terms like ECG, EKG and electrocardiography, electrocardiogram and electrocardiograph. And you guys might also have understood about the myths and facts about ECG. These myths and facts are some common ones, that's why I have taken them. So if you have any query regarding this, you can ask me in comment section. I will be explaining everything for that. Don't forget to subscribe this channel cause I used to come up with these kinds of video weekly. Hit the like button if you like the video and share this video with others also. So this is Amit Mohan Raman signing out. Jai Hind.